So on behalf of our Healthy Smile, Happy Child team and partnership, we're very pleased today to have Dr. Hamideh Alai-Towfigh here today to present some of her thesis work, which is a work in progress right now, speaking on Canadian dentists' views on the first dental visit and early childhood oral health. A little bit of introduction, Dr. Hamideh Alai-Towfigh attained her Bachelor of Science degree from Dalhousie University and then went on to pursue a degree in dentistry at the University of Manitoba. She worked for many years in our community dental clinics and also in private practice. But her interest in children's dental health care led her to do a residency in pediatric dentistry at the university, where she's currently finishing up her third year of her residency and will be completing that by the end of June in the coming year. In her spare time, she enjoys being with family and friends, watching movies and sports. I don't know when she does this, but that might explain the emails after midnight, and traveling for leisure, and also going on dental missions trips overseas. Hamideh and her husband have 3 children, so she's a busy woman, and we're happy to have her today, and we'll turn it over to her. So looking forward to her presentation. And I'll also add that she was runner-up at this year's Canadian Academy of Pediatric Dentistry 3M resident competition for resident research. So we're very excited, and congratulations.
Thank you for the introduction. It is with great pleasure to present to you today. I would like to thank Healthy Smile, Happy Child for giving me the opportunity to present today. The presentation which I'll be sharing with you is the topic of my thesis, which is a work in progress. Now I'll begin my presentation. I'd like to mention that I have no commercial or financial disclosures related to the subject matter in my presentation. I'd like to provide some context to the research. As we know, dental caries is the most common chronic disease in children. It's prevalent in low socioeconomic status groups and minority population. Dental surgery to treat caries is the most common surgical procedure in Canadian pediatric hospitals. Fortunately, there is a greater awareness of prevention and medical management paradigm in dealing with caries. It is important now as dental professionals to start looking at risk factors and keep kids healthy. Now let's look at some definitions. Early childhood caries is the presence of one or more decayed, non-cavitated or cavitated lesions, missing due to caries, or filled tooth surfaces in any primary tooth in a child under the age of 6. Severe early childhood caries is a more advanced form of early childhood caries, and it often requires treatment under general anesthesia. Let's talk about first visits. Several leading dental organizations, including the Canadian Dental Association, the American Dental Association, the American Academy of Pediatric Dentistry, encourage the first dental visit within the first 6 months of the eruption of the first tooth or by 12 months of age. At the first dental visit, the infant's risk of caries should be assessed and discussed with a parent or caregiver. The American Academy of Pediatric Dentistry, the AAPD, in addition recommends that this visit is to help every child have a dental home. The concept of dental home was first introduced by the American Academy of Pediatric Dentistry in 1986. It should be established at first visit. It should be an ongoing relationship between the dentist and the patient. It should be inclusive of all aspects of oral health care, and it should be delivered in a comprehensive, continuously accessible, coordinated, and family-centered way. We're now at the 34-year mark. The purpose of this study was to undertake secondary analysis of data obtained from a national survey of Canadian dentists to determine their knowledge, attitudes, and behaviors relating to the first dental visit. My particular outcome of interest included the mean age recommended for first visit in months and the proportion of dentists that recommended the first visit equal or less than or equal to 12 months of age. My hypothesis was that not all dentists are recommending a first visit by 12 months of age. The other hypothesis was certain provider characteristics and their own knowledge, attitudes, and behaviors shape and influence the age the dentist recommends first visit. This brings me to the methods section. The Canadian Dental Association's Access to Care Working Group identified early first visits as a priority access to care issue. They identified the need to survey Canadian dentists about first visits. In 2013, the Canadian Dental Association generated a list of about 18,000 dentists to survey. About 14,000 of them had an email address and could be contacted to participate in an online survey. The survey was conducted by Navigator, which was an independent research and strategy firm. The population that was targeted were general dentists and pediatric dentists. And the online survey questionnaire included dentist characteristics, dentist knowledge, attitudes, and behaviors about the first dental visit, and infant and toddler dental care. Here is a sample of the email that was sent out. I received this email as well. And we all had an opportunity to respond. The University of Manitoba gave ethics approval, and the Canadian Dental Association provided data and approved secondary analysis. The statistical analysis that was used included descriptive statistics, frequencies, means, and standard deviations, bivariate analysis, chi-square, t-tests, correlation, analysis of variance, ANOVA, and multiple logistic regression. A p-value of less than or equal to 0.05 was considered statistically significant. I did all my own statistics using the number cruncher statistical software, NCSS 2020 version. So out of the sample size of 14,000 dentists, about 3,200 responded, and the response rate was about 22%. Okay, now here are the results for the characteristics. The location was divided into census metropolitan and non-census metropolitan. The Statistics Canada defines census metropolitan as an area of a population of 100,000 and non-census metropolitan as less than that. So they were equally divided between census metropolitan and non-census metropolitan. They were almost divided equally. As far as gender was concerned, there was more males than females. The years in practice was about 20.6 years. And most of the dentists were general dentists. There were 96.6%, and 3.4% were pediatric dentists. And the type of practice that they were at was solo or group, and those were almost divided equally. So here we can see the number of respondents by provinces and territories. As you can see, Ontario had the highest number of respondents. They also have the highest number of dentists. Let's look at knowledge, attitudes, and behaviors of our responding dentists. So the first variable here was if they knew what their dental organizations were recommending, that the first visit be as soon as the first primary tooth erupts and no later than 12 months. About 60% had responded that they knew that. And the mean age that they were recommending was 20.5 months. And then when we dichotomized it into less than 12 months or equal than 12 or greater than 12 months, they were mostly recommending greater than 12 months. It was very interesting and heartwarming that most of them are seeing a child less than 12 months, about 74.2%, but they do not typically see a patient under 12 months of age. Less than 20% do that. And here we can see that the age that they were recommending, about 37.6% of the dentists were recommending between 7 months and 12 months, so under a year. About 25.9% were recommending between 13 months and 24 months, so between ages of 1 and 2. And about 26.9% were recommending between the ages of, in months between 25 and 36 months, between the ages of 2 and 3. This slide shows the dentist recommending the correct age, which is 12 months or less. It is encouraging that British Columbia, about 60.8% are recommending less than 12 months. Manitoba, 62.5% are recommending less than 12 months. And New Brunswick, they're recommending about 61.8% of them are recommending less than or equal to 12 months. And you can see the rest of them are below the 50%. Northwest Territories scores at 100%, and that was because there was 2 participants and they both responded correctly. I used chi-square analysis for this. Here we can see the mean age they recommended by provinces and territories. This is the mean age that they were recommending, about 20.5 months. And this is what they should be recommending, 12 months. Again, British Columbia, Manitoba, New Brunswick are well below the mean age. And Northwest Territory is right on the dot at 12 months, as I'd mentioned before. I used ANOVA to do this analysis. Now I'm going to report on the association between respondent characteristics and recommended age of first visit. So this table I'll explain, it's a bit complex. So this one, the first column is variables, the second column, the mean age that they recommended, and the fourth and fifth column represent, column represents less than or equal to 12 months or greater than, and the fifth column represents greater than 12 months. As far as location is concerned, whether the dentists practiced in census metropolitan or non-census metropolitan, they were, both groups were about the same mean age they were recommending. As far as gender is concerned, the females were recommending closer to the correct age at 18 months, and more of them were recommending the correct age as opposed to the males. For years in practice, it seemed that the younger dentists were recommending the younger age. As far as type of dentist is concerned, the general dentists versus pediatric dentists, the pediatric dentists were recommending the correct age. And if you looked at type of practice, the ones that were recommending closer to the correct age were practice in other, which identifies as either university-based or hospital-based. Dentists who were in those settings were recommending closer to the correct age. And I used chi-square for this analysis. I used t-test for this analysis, correlation for years in practice, and ANOVA for type of practice. Now we come to this frequency table, which gives some more information on knowledge, attitudes, and behavior. So if the dentist promoted early first visit, they were more likely to recommend the correct age. If they used the knee-to-knee positioning, they were more likely, again, to recommend the correct age. It was well received that most of them had heard of the early childhood caries, about 95%. But although they had heard of early childhood caries, only about 50.8% of them were familiar with the term of early childhood caries. About 64.8% were aware of the CDA's position of the first dental visit, and about 58% were familiar with the CDA's position on early childhood caries. So sometimes if they know the correct age, but they might not actually be practicing what they're preaching. So now this next slide, I will focus on the association between comfort and confidence and the recommended age of first visit. So if the dentists were comfortable with providing prevention, they were more likely to recommend the correct age. If they were comfortable providing treatment for the with early childhood caries, they were more likely to recommend the correct age. And if they were confident in their ability to perform a dental exam, they were also more likely to recommend the correct age. This analysis was done using chi-square. With this table, if they had seen a patient less than 12 months, they were more likely to recommend the correct age. If they typically saw a patient under 12 months of age, again, they were more likely to recommend the correct age. And again, if they promoted the early first visits for infants and toddlers, they were more likely to recommend the correct age. And if they used the knee-to-knee positioning, they were also more likely to recommend the correct age. This graph shows the barriers to not seeing patients at that young age. So the dentists were asked, what are the reasons that they're not seeing these young patients? So a lot of them, about 34.6% said few parents see it as a priority, and they were uncomfortable seeing the difficult children, and they didn't think it was necessary. Here we're going to compare the characteristics between the general and pediatric dentists. As far as location is concerned, the general dentists were equally divided between census metropolitan and non-census metropolitan. Pediatric dentists were more concentrated in the census metropolitan. As far as gender is concerned, the male dentists were more than female dentists. The same was with the pediatric dentists. There was more male pediatric dentists than female pediatric dentists. The pediatric dentists were in practice longer, 23.2 years as opposed to 20.6 years for general dentists. And we also noticed that there were more pediatric dentists that identified their type of practice as other, as opposed to the general dentists. And others practice meaning university-based or hospital-based. It's not surprising that the pediatric dentists were recommending the correct age, 12.6 months for the first visit. And also a higher proportion of them were recommending the correct age, 86.4%, as opposed to the general dentists. Then I started to undertake some preliminary logistic regression models as part of my thesis work that I'm sharing with you today. This model is for the age that the dentist recommends for first visit. So these are the variables that I looked at. The odds ratio for years in practice showed that the longer they were in practice, they were actually recommending the correct age, which is kind of was not what we expected. So we're going to talk to the statistician about this. As far as practice location, it did not matter where they practiced, whether they recommended the first visit at 12 months or less than or equal to 12 months. As far as gender is concerned, the odds ratio was 0.76 for males, which means that the male dentists were 24% less likely to recommend the correct age. For type of dentist, the odds ratio was 0.30 for general dentists, meaning that the general dentists were 70% less likely to recommend the correct age. If they typically saw a child less than 12 months, they were almost 7 times more likely to recommend the correct age. If they used the knee-to-knee technique, they were almost twice as likely to recommend the correct age. And if they correctly knew when their professional organization recommended the first visit, they were 5 times more likely to recommend the correct age. So in this study, we found that the mean age recommended for the first visit was 20.5 months. A survey done in 2005, published in 2008, found that Manitoba dentists recommended a mean age of 24.8 months. The free first visit program was launched in 2010 in Manitoba, and a study done after this program was launched in 2011, published in 2013, recommended a mean age of 18.9 months. And with this survey that I'm presenting to you today, done in 2013, the Manitoba dentists are recommending a mean age of 17.2 months. So the mean age probably dropped because of the promotion of earlier visits by the Manitoba Dental Association and the greater awareness of the Manitoba dentists as a result. It's still 5 months later than the target age of 12 months. And here we can see it visually. So with this timeline, you can see that in 2005, it was 24.8 months. The free first visit was launched in 2010. In 2011, the Manitoba dentists were recommending 18.9, and in 2013, they were recommending 17.2 months for the first visit. So the Manitoba dentists have a high rate of response. Survey done in 2005, are Manitoba dentists aware of the recommendation for a first visit to the dentist by age 1 year? The response rate was very high, it was 75%. And a survey done in 2011 called The Dentist's Views on a Province-Wide Campaign Promoting Early Dental Visits for Young Children. The response rate was 63.2%. So thank you, Manitoba dentists, for doing these surveys. In 1993, the Manitoba Dental Association first introduced the concept of a first dental visit program. Free first visit program launched in April 1st, 2010 for a 3-year initiative. The Manitoba Dental Association engaged dentists and dental offices to prepare and equip them to provide free first visit. The free first visit program was marketed to the public through media and even advertising on transit buses. I think we've all seen this ad behind the buses. So as you can see, messaging is important. It's important to convey it early, and there were resources developed and managed. These are the resources that are developed in Manitoba. So free first visit is still standing. So what are we teaching our dental students? In a study in 2015 in Canada, many but not all dental professional programs teach the recommended age for a first dental visit. To better teach infant oral health, dental schools should adhere to national guidelines, remove current barriers to teaching, and provide students with opportunities to see infants and toddlers in their undergraduate learning years. So the provinces of British Columbia, Manitoba, and New Brunswick have something unique about them. Their provincial dental associations have had campaigns to see patients earlier. Females also recommend earlier visits. This is not surprising as it matches the literature with other studies done on the first visit. And naturally, pediatric dentists are well aware of what the timing of the first dental visit. With all studies, there are limitations. The limitations of this study was that there was a small response rate. It was a cross-sectional study. There was also potential for recall and response bias. And it's possible that those responding to survey are interested in the topic, and that's why they responded to the survey, and the findings may not entirely be representative of the average Canadian dentist. And the survey is a few years old. The strengths of the study are that it is the first national survey of the Canadian Dental Association members regarding timing of first dental visit. It was a large sample size. I had all the raw data, and it was a scientific valid research. So let's see if their behavior of the dentist match their knowledge. Many dentists, the majority who are general practitioners, do not recommend first visits by age 1. Many are not aware of the Canadian Dental Association's position on the timing of the first dental visit. Awareness and knowledge do not translate into change in clinical practice. This study will support the Canadian Dental Association's efforts to advocate on behalf of the dental profession, promote oral health for Canadians, and reduce the incidence of early childhood caries. Where do we go from here? We need to teach the importance of first dental visit and early childhood oral health during the undergraduate dental training years. And we have to have parents reach out to dentists and request the early visit. High-risk populations should be identified and be seen early. Indigenous, newcomers, refugees, and immigrants, low socioeconomic status, and rural and remote children benefit the most. Caries risk assessment will determine frequency of visits. The Canadian Dental Association and dental professionals need to work with a general dentist so that they become comfortable seeing patients under 12 months of age. So analysis is still ongoing. My next steps for analysis will be to look at views on dentist perspectives and the influences of barriers to seeing young children in their office, and to undertake more statistical models and look into the data to help identify knowledge, attitudes, behaviors that are associated with first visits. Many dentists do not recommend first dental visit by 12 months, even though this is the CDA's position. Identifying provider characteristics associated with recommending first visits by 12 months of age will help inform educational campaigns targeting general dentists. And hopefully this study will serve as a baseline for future changes in dentist practice, knowledge, attitude, and behaviors. A picture is worth 1,000 words. This is what the Canadian Dental Association was promoting 30 years ago, and this is how far we've become. And in acknowledgement, I'd like to thank the Canadian Dental Association for providing me with their data and permission to undertake their analysis. I'd like to thank my thesis supervisor, Dr. Robert Strauss, and his entire research team. I'd like to thank Dr. Gerald Niznik, College of Dentistry Endowment Fund, for statistical analysis support. Here are my references. Thank you. And if you have any questions, I'd be happy to answer.
Stop share. Okay. Thanks very much, Dr. Towfigh. If anybody has questions, we've got quite a bit of time. If anybody has some verbal questions, or if you want to simply just type your questions into the chat.
It's not changing. So I have a question here. It says, what would your advice to parents be regarding first dental visits during the pandemic? That's a good question. During the pandemic, we can also do, the child doesn't necessarily have to come to the dental office. We could also even do pictures and video chatting, and that is one way of sort of limiting the number of patients in the office. But certainly with this today's technology, we can easily look in the mouth with the parent's camera. And we can still go over what, brushing the teeth, still do a caries risk assessment even via a video chat as well. And we can do everything and go over nutrition, weaning the child off the bottle by 12 months of age. We can do all that over the phone as well. Okay, I have another question here that says, do you have any strategy to change the attitudes of the professionals that still don't follow the CDA's guidelines? This is also one of the things we're working on to see why they know also the dentists know what the CDA is. It's just they don't translate that into practice. So maybe more promotions, more advertising on behalf of the provincial dental associations would help change their attitudes. I have another question. Thank you for your presentation. And how do you see the results of present study with global research? Well, I only know about the Canadian study. This is the first time they've sent the survey out like this. Manitoba has done its own as well, but there have been some also studies in the US, and we do compare with them pretty much the same with the US.
Yeah. Daniela, did you want to read the questions? I was just asking if there's any new questions.
Sure. I see another one. What measures can the CDA take to make the GP see children at 12 months of age?
Well, it is on their website as well, but also more advertising. Like they do send us a lot of information through emails, through the CDA journal, but if they advertise it more as well, it would be a good reminder for dentists to see the early young children for early visits.
And another question, did your questioner ask if most dentists who responded felt comfortable doing early childhood assessments of a child under 1? Can parents take for granted that most dentists are competent or comfortable to do these visits?
So when you go to the dentist for that first visit, they're only having a look and identifying any of the risk factors. So most dentists should be able to do that. I think the reason they don't see them is because the child starts crying, but that's natural. And then when they cry, they open their mouth, so it makes it easier to see.
Another question, in your study, are you planning to look separately at your research questions for general dentist and for pediatric dentist, or are you planning to pool them together?
So the study was done by the Canadian Association. They had a team putting the questions together, and they had sent it to all dentists. So they did not, their target was general dentists and pediatric dentists, but it was sent to all, and the questions were not separated for pediatric dentists or and general dentists. It was all the same questions.
And then being that it's been 7 years since the last survey, do you think there would be a change now if the survey was done again?
Well, as we seen in the last few years, dentists are recommending closer to the correct age, and yes, hopefully they if we ran the survey today, they would be recommending a lower age.
I just have a question regarding Healthy Smile, Happy Child resources and whether there are resources to promote first visits with Healthy Smile, Happy Child.
Sorry, can you repeat that question again?
whether there's Healthy Smile, Happy Child resources that promote first visits.
Yes, there are, and it would be nice if we could use them also to do more advertising and just a reminder that to see the children at a young age, by 12 months.
And then another, did you assess the public health dentist's perspective also?
No, unfortunately, this was just sent out to all the dentists. So I actually, I don't think the dentists identified exactly what specialty they were. Some had, but I don't believe that we had anybody identify actually as a public health dentist.
And also it was a Canada-wide study.
Yes, it should have been sent to all the dentists who had an email address.
Just a comment, hopefully this idea will continue to gain traction. As a mom and a dental assistant, I feel that much earlier visits will perhaps make children less apprehensive and anxious about dental visits as they are older.
Yes, that is actually the whole idea, is to, and when you create a dental home for that first dental visit, it makes the children will get them used to seeing the dentist regularly, and it won't be, so we want to decrease the fear factor. So earlier the better. And
just back again on the Healthy Smile resources, if you could show them on your screen. Any resources? I think I probably
I'll have to go back to showing the side of the share screen. That's just kind of,
I don't know if, yeah, there's certainly, they certainly are on our website, on the Healthy Smile Happy Child website as PDFs. Yeah.
I don't have access to that right now to share with you.
Yeah, I think you just had, yeah. I think you just had one slide with some or something. No, you didn't. No.
I had
I don't know.
I had the poster, and I had
We can go back to the slide. Do you want to go back?
yeah, we can go back to share screen and I can share that.
There's another question. How do you teach students to see infants? Where's the best place to do this training?
So we do have at the University of Manitoba, we have a rotation for fourth-year dental students to come through a community clinic called Smile Plus, and we do see infants there, and we use the knee-to-knee position. And when the fourth-year students come through that rotation, they do see us do the knee-to-knee position.
Don't see any other questions right now. If anybody has. Thank you, Kalita Hi Santiago, who shared the link to the Healthy Smile Happy Child website for the resources. And those are in the chat. And another question, okay, you mentioned Smile Plus. Where else can this be taught? Think of other novel places.
Well, if the dental students usually also go through see some pediatric dental offices, they have actually another rotation there as well. I forgot to mention that. So there are ample opportunities. They could also go to maybe the daycares, you know, anywhere they would, you know, have children to do an exam and get comfortable. I think once, if they're comfortable doing an exam during their training years, then they'll be comfortable doing it when they're out in practice. But if they haven't seen a child that age, that young age in their training, they're going to be less likely to see it in their private practice or wherever they practice.
Now, this is just a continuation. Can you have students go to medical offices or have a mom with an infant come and let multiple students do the exam with them?
Sure, I think that would be an ideal situation.
And another question, have you thought about partnering with OB/GYNs to educate new parents about the importance of first visits?
I think there are, with the public health nurses, there are sort of advertising to, especially to new moms, to take their child to see the dentist by the first birthday. But as to the details, I don't know the details of it, but I've seen advertising that public health nurses are aware of it and do promote it as well.
Is there a value in conducting a follow-up survey? If so, how would you try to convince CDA of this?
Yes, that's a good question. These surveys are very expensive to conduct, so I think cost would be maybe a prohibitive, but it would be good to see a follow-up, you know, like let's say at the 10-year mark, to see if it has made a difference.
See any other questions? I'll give people just a couple seconds. Oh, here comes another one. In Alberta, the well child visit with a public health nurse recently removed the dental discussion from their communication standards. It feels like an uphill battle here.
I wonder why they would do that, especially since Alberta has some areas that are not even fluoridated. So I don't think that's a good idea. Well, we have to you know, perhaps encourage them to put it back in again.
I think we're seeing some of that at screenings here in Manitoba as well, that they're not focusing on the oral health. Are you going to present this at the MDA convention?
I'm hoping to, yes. If there's a virtual presentation, or if there is a convention, yes, absolutely.
And how do you see the role of school teachers in preventive ECC?
Well, actually, they are, so kindergarten teachers, for instance, they would be if they could go over daily brushing, you know, diet, and all those. If children are exposed to these things at a young age, they tend to remember it. So yes, the school teachers would be influential in driving the message home, even in the older years too. So I think teachers also, when they teach, you know, personal hygiene, you know, even in the teenage years, it would be good to do the oral hygiene instructions as well. Reminders are always good. It brings the message home.
Any other questions? Anybody want to? Oh, here comes another one. It seems like a Provincial Dental Association campaign to their members did help increase awareness and knowledge. Do you have any other ideas about how to help them translate this into change in practice?
Well, I think when the CDA or the MDA rather, let's say, sends out their renewal license, maybe a reminder there of things that dentists could do would help, because if you see it often enough, it does actually turn into practice as well. So any reminders that we do get a lot of communication from the Manitoba Dental Association, if they could include that, you know, with a picture. Pictures are also very effective advertising. So if they could do that when they send us their communications, email or regular mail, it would help.
And is there value in doing more targeted surveys of smaller groups of Canadian dentists?
Targeting smaller groups. Like I say, these surveys are expensive to conduct. So if you target a smaller group, you might get a smaller response. So it's better to target a bigger group, and then it would be valuable when you're running statistics.
And do you know if there's been any focus group studies with dentists in Manitoba or elsewhere in Canada about the first visit and free first visit? And if so, do you know what they found?
I know that British Columbia, New Brunswick have run campaigns, and that's why they are also, as my study showed, are recommending the younger age. I think even Prince Edward Island actually has the free first visit. But as far as what they are campaigning or that I'm not aware of.
And then just going back to the partnership with schools, there are 2 homeschooling associations in Manitoba. They could engage their members with this information, especially in light of homeschooling numbers going up in the pandemic.
Yes, actually, that's a good idea because homeschooling is now more prevalent because of pandemic, and so then now the responsibility will fall on the parents. But if these associations could also you know, do a gentle reminder to the parents, dental hygiene, oral hygiene is as important as all the other messages that they're conveying as well.
And then I know we are now wanting to get non-dental providers to do caries risk assessments and then refer to dentists. But are you worried that dental offices might not be willing to see young children? Does the MDA recognize telehealth visits in lieu of an actual physical screening visit? And who would be able to answer this question?
Yes, I'm not aware of what the MDA will sort of how they'll be involved in this, but you know, a lot of you know, because children, infants under the age of 12 months visit the medical doctor a few times before, even before their first birthday. So even having ads in the office or having the dentist, the nurse, the nursing stations emphasize the importance of the first visit would be helpful. So you know, even there are nurses and doctors medical doctors who actually applied fluoride varnish too, so that would, especially in remote communities, because sometimes the reason why the children are not seen at a young age is because there's limited access to care. So if we could avoid, or if we could remove the barriers, and then once the ones that are and assess their caries risk, then we can also maybe have them see the dentist afterwards, because the dentists are not able to see all the children. They're more at high risk, so those should be seen probably first, if access to care is a barrier.
Just a comment that I've heard from pediatricians that they get frustrated when they try to refer kids to dentists and dentists are not accepting young kids. Those pediatricians say that it's a barrier for them to do caries risk assessment.
Right, yeah. Yes, I think it's falls on our, as a dental professionals, to make the dentist comfortable seeing young kids. I think we mentioned one of the barriers is that they cry. But when they cry, they open their mouths. So, and it's a very quick check, and it shouldn't prohibit them from seeing a child that young.
Good. Are there any other questions? That's a great discussion. I think I just saw another one pop up. Should infant oral care be a competency for dental students?
Competency meaning as a test? I think if they just see it even done, you know, they would be more comfortable doing it. It's not a hard thing to do. It's just getting the dental students or the general dentists who are not seeing these young children, it's just getting them comfortable. You know, it's a quick look and doesn't take much time. You only need a mirror. You don't need much, and it doesn't take that long. So it would benefit children.
Are there any videos that could be used to teach first visit techniques?
Oh, I'm sure there's lots available on the internet as well. Yes, there are lots of videos. Actually, there's actually a video on the Canadian Dental Association site of how to do need-to-need exam. So the resources are there. We just have to use them and to practice.
Would Healthy Smile Happy Child or you be able to do a presentation for how to do an exam?
I'm sure.
Good idea for us. Be a good resource.
Yes.
And then how do you manage children under 12 months that parents do bring into the office but are not favorable to need-to-need positioning, or they are crying and don't want to leave their moms?
Well, the need-to-need position, they don't leave their moms, right? So the mom, the caregiver, the parent will sit need-to-need with the general dentist. And when you are actually, the parent is leaning the child back, they see the parent. So in full view, and so the dentist just has a quick look. The child most often will cry, open their mouth, and the dentist can have a look. And but always the child is viewing the parent. So you know,
that's very effective.
The crying should not really be a deterrent. Babies cry, so that's how they communicate.
Yeah, I think the need-to-need when they, you know, after they pop right back up into mom's arms from there, it's a perfect position.
Yeah.
Do you have an approximate of how large the population of young children in the area of study compared with other groups of age?
Sorry?
If I have this right, do you have an approximate of how large is the population of young children in the area of study compared with other groups of age?
So my study didn't analyze how many children there were, so I think maybe the question means also how is the area populated with young children, and that would be something that I think we could look at the demographics to see how many young children are in the
in Canada.
It wasn't focused on a particular group.
And that it was a nationwide study. So
yes, it was sent to all Canadian dentists across Canada.
To your knowledge, have any surveys considered when dental therapists or dental hygienists are first seeing babies or children? In many Indigenous communities, a lot of the primary care is through dental therapists or the Children's Oral Health Initiative program and community oral health aides.
No, I don't know of any surveys that were done, were aimed at dental therapists or dental hygienists. But if they are seeing the most of the children, it would be a good idea to see their view. Yeah, as they do, and as in remote communities, their children are mostly seen by the dental therapists.
Mm-hmm.
Yeah, the community oral health, they do track that information.
That's great. If there's I'll just wait a couple minutes just to see if anyone else has questions, but this has been a really great discussion. And thanks very much, Dr. Towfigh. Oh,
Thank
I have another one. You're not done yet. Oh, excellent presentation. Seeing children early without pain will give them confidence and they will look forward to the next visit. Interesting topic. Thank you. That's a good way to close.
Thank you. Thanks for listening.